Every year, millions of people mistake influenza for just a bad cold. But influenza is far more than that. It can knock you off your feet within hours, spread rapidly through communities, and in some cases, lead to serious complications, especially for children, older adults, and people with weak immunity. In this video, we'll break down what influenza really is, how it spreads, why it can be dangerous, and most importantly, how you can protect yourself and your family. Influenza, commonly called the flu, is a viral infection that primarily attacks the respiratory system, your nose, throat, and lungs. It is caused by influenza viruses, mainly Influenza A and Influenza B. These viruses are constantly changing, which is why people can get the flu more than once in their lifetime. Unlike the common cold, influenza often starts suddenly, causes intense symptoms, affects the entire body, not just the nose and throat. Influenza spreads very easily, especially in crowded places. The virus travels through respiratory droplets when an infected person coughs, sneezes, or talks, touching contaminated surfaces, then touching your nose, mouth, or eyes. A critical point most people don't realize: you can spread influenza even before symptoms appear, usually one day before and up to 5 to 7 days after getting sick. That's why outbreaks spread so fast in schools, offices, and homes. Influenza symptoms tend to be sudden and severe. Common signs include high fever with chills, severe body and muscle aches, headache, extreme fatigue or weakness, dry cough, sore throat, runny or blocked nose. In children, influenza may also cause vomiting, diarrhea. If symptoms hit hard and fast, it's often influenza, not a cold. For many healthy people, influenza improves within 1 to 2 weeks. But for some, it can become life-threatening. Serious complications include pneumonia, bronchitis, worsening of asthma or heart disease, ear and sinus infections. High-risk groups include children under 5 years, adults over 65 years, pregnant women, people with diabetes, heart disease, or weak immunity. In these individuals, influenza can lead to hospitalization and, in severe cases, death. That's why early recognition and prevention are so important. Doctors usually diagnose influenza based on symptoms, medical history, physical examination. In some cases, especially during outbreaks or in high-risk patients, lab tests may be done using nasal or throat swabs. Early diagnosis matters because antiviral medications work best within the first 48 hours of symptom onset. Most people with influenza can recover at home with proper care. Key steps include plenty of rest, drinking fluids to prevent dehydration, fever-reducing medications as advised by a doctor. Doctors may prescribe antiviral medicines, which can reduce symptom severity, shorten illness duration, lower the risk of complications. Antibiotics do not work against influenza because it is a viral infection. Prevention is always better than treatment. The most effective protection is the annual influenza vaccination. The flu vaccine reduces your risk of severe illness, lowers hospitalization rates, protects vulnerable people around you. Additional prevention tips: wash hands frequently, avoid touching your face, cover coughs and sneezes, stay home if you are sick. Wear mask in crowded or high-risk settings. Small habits can save lives. Influenza is not just a seasonal illness. It's a serious viral infection, but with awareness, early care, and prevention, it is highly manageable. If you found this video helpful, like the video, subscribe for more science-based health content. Share this with someone who needs to stay protected this flu season. Stay informed. Stay healthy. And we'll see you in the next video.